Hello, so this is Chapter 11, Opioid Use and Misuse. An estimated 73% of persons in moderate to severe pain receive inadequate analgesics due to physicians' fear of inducing an iatrogenic substance use disorder. Approximately 74.6% increase in number of prescription analgesics between 2002 and 2010. Narcotics is also involved in 40% of overdose deaths in recent years. A short history of natural and synthetic opioids. Opioid has been used as an analgesic for at least 3,500 years. First accumulated as a crop 10,000 years ago, though the reasons are unclear. In 1806, morphine was isolated as the main active ingredient in opium, and in 1857, the hypodermic needle was invented. By the Civil War, both were available without a prescription. Morphine was often a hidden ingredient in over-the-counter patent medicines. By 1900, more than 4% of the U.S. population was addicted to opium and other narcotics. The Pure Food and Drug Act of 1906 required ingredients be listed on medications. The Harrison Narcotics Act of 1914 ruled that only a licensed physician or dentist prescribed a narcotic analgesic. For those 35 to 54 years of age, narcotic overdose deaths are higher than firearms or MVA deaths. Medical applications of narcotic analgesics. Classification of narcotic analgesics, natural opioids, semi-synthetic opioids, synthetic opioids. The problem of pain. Acute, non-cancer, chronic, and cancer-induced or related. Substances to reduce or block awareness pain. Current medical uses of narcotic analgesics. For thousands of years, opium was one of the few compounds available to treat pain. Narcotic analgesics are used for pain, cough, suppression, and severe diarrhea. It is estimated that 36% of the U.S. adult population took a prescription pain reliever in the past year. Vast majority of users take narcotic analgesics for short-term pain control, but nearly half use them for more than 2 years, and 1 in 5 for more than 5 years. Pharmacology of narcotic analgesics. Morphine is the gold standard against which effects of narcotics are measured. Pain suppression is achieved through different mechanisms, inhibiting pain signals from the spinal cord to the brain, activating pain-suppressing systems in brain and spinal cord, altering perception of emotional response to pain. Pharmacology of narcotic anesthetics. It has the ability to mimic the effects of endogenous opioid peptides. Each family of opioid peptides is found mainly in a specific region of the brain with some overlap. Narcotic analgesics are opioid agonists, stimulating or enhancing their effect. Subjective effects of narcotic analgesics differ in those in pain versus those in significant pain. Narcotic-induced euphoria involves the ventral tegmental region of the brain. Codeine, first isolated in 1832, found to have mild analgesic potential. 10% of biotransformed into morphine. 1/5 as potent as morphine, usually administered orally, commonly mixed with OTCs, analgesics like aspirin or acetaminophen for control of mild pain. Fentanyl, a synthetic opioid introduced in the United States in 1968, popular during and immediately after surgery, well absorbed from intramuscular and intravenous administration, quite potent. Typically, intravenous dose equals 1 microgram. Suppresses respiration longer than it induces anesthesia. It can cause anxiety, hallucinations, or feelings of depression. Can cause 25% reduction in cardiac rate. Heroin. Heroin is just 2 morphine molecules joined together by an oxygen molecule. It is twice as potent as morphine. Heroin crosses the blood-brain barrier faster than morphine. It is not used medically in the United States, but is used in other countries to treat severe pain. It may have a cardioprotective mechanism. Hydrocodone or hydromorphine. It is a semi-synthetic narcotic derived from codeine, though it is more toxic than codeine. It is used to control coughs and mild to moderate levels of pain relief. Orally administered doses of hydromorphine are thought to be 5 to 7 times as potent as morphine. Side effects include dizziness, sedation, mental confusion, anxiety, fear, nausea, and/or vomiting, dysphoria, and respiratory depression. Methadone, synthetic opioid developed in the 1930s, used as a substitute for morphine during World War II, used in methadone maintenance programs. About as potent as morphine, tolerance to different effects develops unevenly, can induce cardiac arrhythmias, both when used at therapeutic doses. When used as prescribed, has a very good safety profile, but will interact with over 100 different pharmaceuticals. Morphine, first isolated more than 150 years ago, usually administered by intramuscular or intravenous injections, because oral administration leads to biotransformation or 60 to 80% of ingested dose. Peak blood level achieved 30 to 60 minutes after intravenous administration. Analgesic effects last an average of 2 to 3 hours. Oxycontin, it was introduced in 1995 as a time-release form of oxycodone, a synthetic opioid. It comes in 2 forms, standard and controlled release. A relatively stable blood level of Oxycontin could be reached after 2 or 3 doses, providing better pain control than could be achieved using short-acting narcotics anesthetics. Oxycontin has become a major drug of misuse. Tramadol, a distant chemical cousin of codeine, used to treat mild and to moderate levels of pain, thought to be about as potent as morphine, may be more toxic than originally thought. Close to 10% of those prescribed tramadol misuse it. Complications caused by narcotic anesthetics in medical practice use. Constriction of the pupils, respiratory depression, gastrointestinal side effects, blood pressure effects. Other effects: urinary retention, sedation, irritability and depression, physician-induced addiction. Opioids as drugs of misuse. Popular because they can make people feel good. Depending on several factors, subjective pleasure can range from mild or comparable to an orgasm. Globally, about 11.7 million users, 9.3 million heroin users in Asia, 3.6 million heroin users in Europe, and 1.2 million heroin users in the United States. Opioid of misuse. Heroin crosses blood-brain barrier 100 times more rapidly than morphine. Codeine has emerged as a drug of abuse, accounting for 10% of all drug-related deaths. Oxycontin, it has been estimated that 13.7 million people in the United States have used Oxycontin for non-medical purposes in the year 2003. Buprenorphine, administered sublingually, is a potentially treatment for opioid addiction. Intravenously administered has significant misuse potential. Methods of opioid misuse: injected under the skin, quote-unquote skin popping, injected directly into a vein, intravenously, smoked, or used intranasally. Opioid use and misuse and DSM-5. So you have opioid use disorder, opioid intoxication, opioid withdrawal, other opioid-induced disorders, and unspecified opioid-related disorders. So that's it for this chapter.